Recently, Khloe Kardashian shared with her followers over on her Instagram stories that she had developed a tumor on her face that had to be removed. We're going to talk all about it in this video, but before getting into it, be sure you're subscribed if you like skincare content from a board-certified dermatologist, and hit that little bell icon to turn on your bell notifications. That way YouTube will let you know as soon as my videos go live, that way you don't miss out on any of them. The Kardashians are well known for abundantly sharing with their following. And as I said, Khloe shared on her stories she had developed this tumor. She thought it was a pimple originally, a pimple, an acne cyst. However, it didn't go away. Doesn't sound like it really bothered her. She didn't say anything about it being painful, itchy, bleeding, oozing. We really don't get a lot of information about it from her. 7 months later, it was still there. She had her dermatologist look at it. Sounds like they did a skin biopsy. And she even had another dermatologist, I believe, look at it. She was told that she had a skin tumor that immediately needed to be removed. She sought out the services of a plastic surgeon who excised it. And she was told that the margins were clear, which is reassuring to hear whenever we're talking about a tumor in the skin. That is the goal, is to remove it in total. So what the heck did she have on her face? Honestly, I don't know. She didn't share that, nor should she have to. It's great that she's open with her following about having a skin tumor that had to be excised, but we don't know what kind it is. There are a lot of different types of tumors that can pop up, especially on the face, the head, the neck in general. Many of them, while not cancerous, do need to be removed because they can put down roots and spread into the skin and become cosmetically disfiguring, and their removal, if put off, becomes more involved and you're left with a larger scar. I'm assuming that is what they meant by this needs to be removed immediately. We're not told anything about the type of tumor. I believe Khloe has revealed, however, in the past that she does actually have a history of melanoma that she developed at the age of 19 on the back, so that is certainly relevant. Great that she shared that history as well with her following. Skin cancers, they're not just something that you hear about. Actual people, even young people, do develop them. One of the things I want to highlight about her history, though, that is so important, and one of the reasons why I'm so glad that she shared this with her audience, she said it started out as something that she thought was a pimple, but it didn't go away. 7 months later, it was still there. That's something that is very common in the history of any type of skin tumor or skin cancer. If you have something that you think is a pimple or an acne cyst, but it doesn't go away for months and months and months, that's not acne. Sure, you can get a new breakout somewhere nearby. You can get another pimple after that one goes away in the same place. But an individual skin lesion that persists for months and months and months, it's not acne. This is something that older adults commonly report when they come into the dermatologist. They're like, I had this bump on my nose for a long time. I just thought it was a pimple. I squeezed it, but it never goes away. That is a classic history that people give when they actually have a skin cancer. There are a lot of different skin tumors that can occur, especially on the face. You have a lot of sebaceous oil glands. You have a lot of hair follicles on your face, and you can develop tumors within the hair follicles in any part of the hair follicle. There are a lot of different types of cells within a hair follicle or within a pore, and each of those types of cells has the potential to grow some type of tumor. As a dermatologist, trust me when I tell you, there are so many tumors that can happen in a hair follicle. But skin cancers, they are very common. I have a lot of videos on this channel all about skin cancers. I even have a whole playlist about skin cancer. Highly suggest you check it out. Of course, the deadly melanoma, which she obviously said she had a history of. You also have, more commonly, something called basal cell carcinoma. This is a skin cancer that arises in the keratinocytes. Basal cell carcinoma is probably one of the most common skin cancers out there. It's a very slow growing skin tumor, and it can happen really anywhere on the body, but it's very common on the head. As a matter of fact, 85% of all basal cell skin cancers will occur on the face, the head, or the neck, and that includes the scalp as well. And they can look like a variety of different things. The one way that they appear that kind of tricks people into assuming initially that it's like an acne cyst is they can have kind of a nodular appearance. And by nodule, I mean something that you can almost kind of put your fingers around. They can be skin colored, and they often have little blood vessels overlying them, and eventually they can ulcerate, meaning they get a little dimple in the center. They can ooze, bleed, crust over. They're usually not painful, but they can itch, and if they are itchy, then that can be a clue that maybe they are going a little bit deeper into the skin and possibly involving one of the little nerves in the skin. The borders of these skin cancers, they kind of have this rolled appearance to them. They're often described as a pearly papule, but basal cells can also have different colors in them. They can be brown, black, they can be more flat. They can actually look like a scar in some cases, certain types. Risk factors for developing basal cell carcinoma are related to sun exposure, UV exposure, especially in early childhood. The sun exposure that you get in your early childhood probably is what sets the stage for basal cell carcinoma later on in life. The latency period from exposure to UV to actually forming a basal cell carcinoma is approximately 20 to 50 years. Now, people are living longer and longer, and the older you get, the greater your risk of developing a basal cell carcinoma. One of the greatest risks for basal cell carcinoma is living a long time. The longer you live, the greater the chances that you're gonna make one of these eventually, especially if you are a pale skin type, and especially if you got a lot of sun exposure in early childhood. If you've ever used a tanning bed, that certainly is a risk factor. If you have a history of receiving radiation treatments for something else in the past, that puts you at an increased risk for developing basal cell carcinoma. Historically, men are more likely to develop these than women, likely because, at least in the past, men were more likely to have occupations that required them to have a lot of outdoor sun exposure. The medication hydrochlorothiazide, it's a diuretic that's prescribed for high blood pressure. It's actually, we have learned, is a very strong photosensitizer. It makes you a lot more sensitive to the sun, and it certainly can increase your risk for developing basal cell carcinoma, and that is dose dependent, meaning the longer that you're on it, the higher cumulative dose that you receive, the greater your risk for basal cell carcinoma. Now, basal cell carcinoma, it's not dangerous. People are not dropping dead from basal cell carcinoma. Sure, there are rare instances where it can potentially metastasize, but usually that's going to be in somebody who has an underlying genetic condition that puts them at risk for making these. It is slow growing, non-dangerous, but we do need to take care of it because it can infiltrate into the deeper layers of the skin and it can spread out and kind of take over. And we're talking about your face, that ends up being pretty disfiguring. Treating it early and making sure that we get all of it out ensures the best possible outcome. A type of surgery that we do on these, especially when they occur on the face, is called Mohs surgery. And basically what that is removing small pieces at a time and examining those pieces of excised tissue under the microscope until there's no more tumor left in the skin. This way you remove as little skin and tissue as possible while ensuring that you get all of it out. That's really ideal when we're talking about your face, because the more stuff you take out, the harder it's going to be to piece things back together. And so that is why Mohs surgery, that is another benefit of Mohs surgery. There's another tumor that's actually pretty common in young children. It's called a pilomatricoma. These derive from the hair, cells in the hair, the matrix cells in the hair. And they can occur on the face, really anywhere where you have a hair follicle, but they are more common on the head and neck. They are rock hard, usually because they calcify. And because of the calcification, they kind of take on this angulated shape. It's called the tent sign, like they almost look like a little tent. I brought these up because they are a lot more common on the cheek for whatever reason, and it sounds like that is where this skin lesion she developed that she describes as a tumor arose. They're usually solitary, meaning you don't have multiple, very slow growing, firm. They're not dangerous, they're not a cancer, but they do need to be excised. They're not gonna spontaneously go away, and they can continue to grow. Very, very rarely, however, a pilomatricoma, it actually can develop into a cancer. It's called a pilomatrix carcinoma. Very rare, but they can occur as well. Another reason to remove these, because a pilomatrix carcinoma, it actually can go on to spread to the lymph nodes and metastasize. You have a tumor called a trichoepithelioma. You can have just one of these, or you can have multiple of them. There are certain genetic conditions that predispose individuals to making multiple of these, but you can spontaneously develop one. They're common on the face, and they're like a little nodule. They're not a cancer. They likely come about from the cells that make up a part of the hair referred to as the bulge region. They grow really, really slowly, but they're not gonna just spontaneously go away, so they need to be removed as well with an excision. Very rarely they can develop into a high-grade cancer, but that again is super rare. You also can develop a tumor on the face within the sweat glands. One that comes to mind is microcystic adnexal carcinoma, or a MAC. They have a predilection for the central face, especially on the upper lip, but they can happen really anywhere on the face. I've never seen a case of one on the cheek, but it's a possibility. These can appear at any age. As a matter of fact, there's even a report of one occurring in an infant, and I think the oldest age reported is 90, but the average age is in the 5th and 6th decades, 50s and 60s. But these are actually pretty aggressive, meaning they invade around the area pretty tenaciously, and they do need to be excised. Now, they're not the type of cancer that goes on to cause death, but they do need to be removed because they can certainly be incredibly disfiguring. They can cause pain, discomfort, and they have to be removed using that special type of surgery, Mohs surgery, to ensure that the margins are clear. Because if you get all the tumor out, the prognosis, meaning the outcome, is actually quite good. They have a very, very modest risk of reoccurring, and the risk of them metastasizing, meaning spreading to other areas of the body, is pretty low. People who develop these often have a history of radiation therapy. Anywhere from 19 to 50% of patients who get these have that history. Those are some tumors that can happen on your face, but by all means, this is not an exhaustive review of all adnexal neoplasms that can arise on the head and neck. That is, you know, do a derm residency if you want to learn that stuff. It's very dry material. She may have had a skin cancer. She may have had a tumor that just becomes very comfortable in the area and spreads out and needs to be removed, but is not necessarily life-threatening, but is potentially disfiguring. It's her face. The Kardashians, their brand is their appearance. So no pressure on the surgeon who had to remove this, but it sounds like, you know, she was happy and things worked out well, which is good. So hopefully that information, you know, is educational and helpful for you guys. Take home point is tumors on the head and neck, very common. And if it looks like a pimple and you think it's a pimple, but it doesn't go away, definitely get in to see a board certified dermatologist to have it looked at, because it could be any one of these, you know, what are referred to as adnexal tumors, meaning tumors that arise from like the hair follicle, the sweat gland, the sebaceous oil gland, or it could be a skin cancer, like a basal cell carcinoma. Just because you're a young person does not mean you can't get these. And if you've ever been in a tanning bed, you know, all the more reason to be extra militant. Tanning beds do increase your risk of developing skin cancers, especially if you went in one before the age of 25. Like I said at the beginning, I really appreciate that she shared this information with her audience. You know, the Kardashians, say what you will about them, but I do like it when celebrities are open with their audience that they had some kind of a medical thing, and, you know, encouraging their audience to see a healthcare professional, to have things looked at, to not blow things off. I really think that's a good message to send. And to you know, I saw an interview, she reiterated that she wears sunscreen every day, given her history of melanoma, which I think is a really good thing for her to be doing. And I greatly appreciate that. You know, Kim Kardashian has been very open about having psoriasis and the impacts of that. And I think that's helpful information to share with your audience, provided they're not trying to give out medical advice on these things other than see a healthcare professional, which sounds like that is what she did. All that to say, you know, recently I did a video about the increasing wait time to get in to see a board certified dermatologist. And that is something that is really actually across the board of all medical specialties, not all, but many medical specialties, there is an increased wait time to get in to see the doctor. And that is even more of an issue for people who live in rural areas where there may be fewer doctors per person. And it's even certainly a huge issue for people who are low income and or uninsured to have that access. So the message, while correct and good, it's becoming even more challenging for people these days. And like I said, a lot of these tumors, they're not life-threatening, but they certainly can be incredibly disfiguring. And the longer the wait time to get in to see a dermatologist, it can impact the extent to which these things grow and end up needing even more care. Delays in treatment are serious. And I think that is one thing that, while it's great she shared this, let's be honest, if you're a Kardashian and you have a sniffle, you can get in to see, you know, the best ENT on the planet in a matter of seconds. They have that fast access. They have the money to fund it, and that's not going to be the case for majority of the general public. What do you guys think though? Let me know in the comments, because I have some thoughts on this, which I won't get into in this video. But what do you guys think about the fact that in media articles and on her social media, she's tagging the Instagram accounts of the doctors that she saw? What do you guys think of that? The celebrity endorsement for the medical care that she received. How do you think that that impacts people's perceptions of, I don't know, doctors, or them thinking that these are the best doctors? What do you guys think about that? I'm curious to know your thoughts. I have some opinions, maybe something to talk about in a later video on taking care of VIP patients, because it's a real thing. You know, celebrities get sick, they need medical care, and they should have medical care, not denying that, but, you know, remaining unbiased in treating VIPs, as they're called, VIP patients. I get that she wanted to, you know, say thank you, but you can do that by just leaving the names out, like a big thank you to my medical team. It's interesting though that she tagged the individual Instagram accounts of the physician she saw. It's like, you know, an endorsement basically. I am going to wrap this video up here. I hope you guys enjoyed it. On the end slate, I will link one of my other celebrity response videos. If you want to check that out. I think the last one I did was reacting to Brad Pitt's exorbitantly overpriced skincare brand. So check that out if you missed it. But if you guys enjoyed this one, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.